doing a live stream, interacting with your followers, your viewers, at the same time, and dispensing medication and giving it to patients. And then, to make it worse, it seemed as though she was calling the patients by their name. Hi everyone, welcome to the channel. Thank you so much for tuning in. I do hope you guys are having a wonderful week. It is pretty good outside. Temperature is 82 degrees and the time is 11 minutes after 9. So I'm expected to be at my first location by 10:06 based on what the GPS is saying. Alright, so kind of want to just talk on a little thing that I noticed the other day regarding social media and a lot of nurses who are posting on social media. If you have a subscribers here, remember to go ahead and subscribe to my channel, like, share, turn your notification bell on. You can follow me on TikTok at ThinkNursing1 as in number 1, and you can subscribe to my page at ThinkNursing on YouTube. Alright, I'm also on Facebook at ThinkNursing, so you can go ahead and check that out. Yeah, so the other day I saw this disturbing post. I didn't see the actual live, but I heard about it. So I went and looked it up, where someone was doing a live stream while on the job. That person was at work doing a live stream. And why it's so disturbing is because, sorry, the camera or the video looks a little bit dark. But why it's so disturbing is that this person is a nurse. This person is a nurse who is caring for patients and doing a live stream while she is doing medication pass. She's serving medication. What a time to go ahead and do a live stream. Even if you decided that you wanted to do the live stream on the job, why at medication pass? That's the time she feels as though it's appropriate to go ahead and do a live stream. In nursing school, you're taught during medication, you don't even want to talk, you don't want to look the other direction, you want to focus on the medications that you're going to be dispensing. You understand? When you get in report, it's you and the person who is handing over the medication should be having an interaction. Your eyes are supposed to be on the medication. You're looking, you're double checking, and all of those things. How is it that you can be focused doing a live stream, interacting with your followers, your viewers, at the same time, and dispensing medication and giving it to patients? And then, to make it worse, it seemed as though she was calling the patients by their name. Which, you can be calling John, you have a million Johns out there. But if other persons know where you're working, if other persons know that you were doing a live stream, especially the patient, the family member, and they know that's where you were working and they can identify, you are just implicating yourself in a situation where there is so much proof against you as a nurse. There is so much proof against you. Nobody not going to want to back you up because it is something that is publicized to the entire world. Even though it's not like you went viral at the time because of something good you were doing. You went viral because it was bad. At the time I was told she had only about, let's say, 70. I think they said 68. I see some persons say 70. She had like 68 to 70. Less than 100 viewers at the time of the live stream while she was doing her medication administration in that possibly nursing home, the home for the elderly. Yeah, so it seemed as though she had only less than 100 viewers at the time. And when persons came on and saw her doing the live stream, Some were boosting her for doing a good job. Some were telling her to come off the stream because it's not appropriate. You know, some were telling her that she's violating HIPAA, I guess because, you know, they could hear the patient's name. She said she wasn't showing the patient's information. That's the only time she would have been, you know, considered to be violating HIPAA. But no, apparently she was calling the name of the patients clearly on the internet. You have persons who probably are aware of where she works. You understand? They know John, Tom, Dick, Harry in the facility. You are violating the patient's privacy there. You're violating the patient's privacy. You understand? The other thing is, how is it that she is so comfortable doing a live stream on a job that somebody is paying her for? You know, you're on somebody else's time and you're doing a very, very large video. You're doing a live stream to persons out there while you're on somebody else's job. It's just not right. Persons are paying you to take care of patients. They're not paying you to come to work and do live stream and TikTok and Instagram and all of those things on the job. Yes, we do it in our spare time because sometimes we have downtime and we do it discreetly. You understand? When you're on your break, you're expected to clock out on your break and you can take your break and do anything you want to do. So if you see somebody at work and they're in their uniform and they're doing their live stream, we don't know whether or not those persons have clocked out for their lunch. We don't know whether or not they're on their personal time, because you're entitled to your lunch break and you can do whatever you want on your lunch break. Even if you're doing a live stream at work on your lunch break, as long as it's not implicating anybody, as long as you're not putting the hospital face out there to say this is what is happening, so persons can be like, oh, but I don't want to work at that hospital. I don't want my patients to go to that hospital. I don't want my relatives to be in that hospital because this is what the nurses there are doing. You know, just don't put anything out there that is going to implicate yourself, the hospital, put the patients at risk for different things that are happening out there, and tarnish your brand. You understand? Because even though, yes, you might not have 1 million subscribers and you probably feel as though you're not that much of a brand, you are still a brand. You're a public figure out there. You're a public figure out there. So you need to make sure that whatever you're doing it correctly and not doing it just because you just feel as though, yes, you've been doing nursing for a little while and you've been taking care of patients. You know what HIPAA is. You know that, you know, you're not showcasing any patient's information, so it's okay. No, not because of that. Make sure you're doing it, and at the end of the day, you are benefiting from it. Don't let it be a case where you go out and you're doing something on social media and someone sees it. The thing with social media, there are so many persons out there that are your friends on social media, but you don't know them. These are like virtual people. Some you do know, others you don't know them. So what they can do is they can be very discreet in hopping onto your page, and you don't even know that the person who is commenting, liking, sharing is your boss, is your human and resource management team. You understand? There's so many different persons. You have enemies out there to you that you don't even know, because sometimes you're growing on YouTube, you're growing on TikTok, Instagram, any of those social media platforms, and you have other persons out there who will envy you and they don't like it, so they go ahead and what? They go and report it to your hospital. They go and report it to the board of nursing. They go and report it to your boss. And who would want to jeopardize their job, their license, for a mere 1 hour on social media, even if you get 5,000 likes? Who would want to jeopardize that? There are more days you can go ahead and do your live. You understand? There's so many days out there where you can go and do your live and get more views and still keep your license, your job. You understand? And still have a good reputation. So whenever you find yourself in a position where you need another job and you apply to get the job, you can be amongst the few that they will say, okay, then I will go ahead and hire Stacy. I will go ahead and hire Tom, because on social media, she seems as though she's not using it poorly or badly. She's using it in a positive way to influence others. It's not causing any harm to my company, my business. You understand? So when we go out there, we have to think of it that the persons that are watching are the persons from your job, even if you don't know them. Just put it in the back of your mind that whatever content you're posting, it is something that everybody can sit down and watch and not feel as though they are regretting hiring you or giving you a pass in the class because they saw where, you know, they thought you had the potential. But then they give you the one little A and let you pass the course, and then you come out and do something looking like this, where you are on social media doing live stream as though you never did introduction to nursing, intro to profession of nursing, and you never read on the policies of the facility or the institution that you were hired to work at. Don't let it be a case like that. Don't let it be a case like that. Can you imagine now how many persons have seen this video? Because you've gone viral. You've gone viral. You've gone viral into the board of nursing. You've gone viral to the ethics committee. You've gone viral to your boss, your manager. You've gone viral to the point where there's a high possibility that you'll be losing your license and you won't be able to work as a nurse again. And then to make things worse, I heard she made mention that she's a new grad. She graduated in August. And curious I am, I was wondering which August she was talking, if it was August of last year. So I went ahead and looked up just information to see if this is really a new nurse out there. Because most of the time, you know, the new nurses are the ones that will be out there doing things. And hopefully you're hoping that they will learn from whatever situations they are in. They will learn from whatever situations they're in. But sometimes they make the mistake and it's too far ahead. It's too bad for them already. You understand? So they can't learn from it. But when I look at it, I realize that, yeah, she was talking the truth. She is a new nurse that graduated in August, and now it is what? Little over 6 months, not even 1 year. Not even 1 year. You understand? Since you've gotten the license, and you are in a situation now where you are possibly gonna be losing your license. And lo and behold, nursing school is not easy. Nursing school is not easy, you know. Nursing school is not easy. So I don't know how it is that persons find it so easy for them to have their license being revoked or being taken away from them. They're banned from working as a nurse. You understand? Because of these kind of behavior. How is it? Is it a case where when you were going, you weren't struggling, you weren't having a hard time? And even if you weren't struggling financially, there must be some form of struggling, because may I tell you, when it comes on to mental health, dealing with your mental health in nursing school, that is something you have to take care of. And a lot of persons are struggling with it because they are stressed out in nursing school. Because nursing school is not a walkthrough. It's not a walkthrough. So I don't know if it's a case where she walked through nursing school and did so well, where she never really under any pressure, there was no challenges that she encountered. Why she just feel as though the best time to go ahead and do a live stream is when you're medicating patient, when you're supposed to be so observant at that time. You're supposed to be not distracted by anything. That's what they teach us. You're not supposed to be distracted. And if you realize when you are doing your medication, there's so many different paths that you need to do. You need to do different checks to make sure you're giving the right patient the medication. The different rights to medication administration. And I don't think she was able to do any of those, because she was back and forth between her live cussing people, blocking persons, even when they were trying to save her little license and she never realized. If somebody said to me on a live that I am doing, you know what you're doing is not right, and the first thing they say is HIPAA, me I turn off the live. You understand? I question myself, why would that person say I'm violating? Did I do something wrong? Turn off the live. I remember at one point I was doing a live. Was it a live? It wasn't a live. I was doing a presentation. Well, I was doing a video for the YouTube page, and when I did the video, I was using examples from my work. Patients that I've encountered. I don't give, whether or not the patient is Tom living in X. Persons know that yes, I am in Texas, based on the fact that, you know, you have to put in a location. But aside from that, the information that I gave was very vague. The information was just like when you're reading a textbook and they say you have 73-year-old black female pregnant, this is her complaint, and this is how you go about with managing. It's the same thing I was doing, and the person said that I was violating HIPAA, and I say, how is it that I am violating HIPAA when there is no patient identifier here? I didn't give a name, I didn't give a date of birth, I didn't give a location as to where the patient was, I didn't give a patient chart information. There's no way for you to say a 50-odd-year-old female with hypertension, diabetes is your mom, your dad that I am talking about. You don't know, because there's nothing there to identify who I'm talking to. You understand? You don't know who am I referring to. So I haven't violated. So I went ahead and make sure I read up a little bit more regarding HIPAA and how you can go about. So I went online and I put into chat and I said, chat, this is the situation. Am I violating HIPAA? Chat says no. I know that chat is, you know, artificial intelligence, but most of the time the information. So they went ahead and they pull up different information from the different boards that can help with, you know, making sure that you have concrete information. And it specifically said, as long as you do not give out any patient identifier, you're okay. So you can always, and they gave the example. So I'm like, okay, then what is this guy talking about? And then some other persons went ahead and started commenting under his post to say that no, she's not violating. I'm using my examples as a form of education. I'm providing you with education, just like how the textbook would give you the information. Is the same thing. They give us multiple information, geographic location, to say this patient is from the US, this patient is from, you know, the Caribbean, the North, from Africa, or different places in the world. But you're not going to know when you're reading the textbook. You're not going to know which patient. The patient could be even you. But you're not going to know because they never give anything to say that you're the person they're referring to. So if you don't call no name, if you don't give no date of birth, if you don't give a medical record information, if you don't show the patient information on the live stream, you know, that is different. But when you go ahead and do all of those, definitely you are violating the patient's privacy, the patient's, you know, rights as a patient. You understand? And when it comes on to medication management, you don't want to find yourself administering medication and showcasing patients' information at the same time on a live stream, because it's going to be bad for you. The main reason why you have the different rights for medication administration is to prevent any form of errors. You want to make sure you're giving the medication to the right person. And on the live stream, you can see that obviously she went ahead and made a error with her medication. She went ahead and make an error with her medication, you know. She went ahead and made an error with her medication because it seemed as though the time she was medicating the patient with the lidocaine, it wasn't due at that time. But because it's a lidocaine patch, she went in and, you know, make it seem as though it's okay. It doesn't matter. A medication error is a medication error. So even if you're supposed to give saline, as long as it is ordered, if you give it at the wrong time and it wasn't supposed to be given at that time, it is an error. You understand? So not because it could have been something worse. It could have been something worse. What if you were there pulling up insulin? What if you were there supposed to give insulin and you pull up potassium? Even if you never give it and you realize at the time when you were going to push that potassium because you think it's supposed to be pushed, or you think it was insulin. And even if you get, you caught yourself at that time, it's an error, it's a near miss. It is something, it's a medication that is considered to be lethal, detrimental to the patient. So if you never realize at that time, the patient could have had a cardiac arrest because you went ahead and pushed potassium. So it is still an error. So it doesn't have to be a case where you give the medication the wrong time or the right time, or the patient never have any negative effects from the medication. Depending on what it is, and the attempt to do it sometimes is considered to be an error, near miss, needs a write-up. You understand? So you have to look at all of those things and make sure that you are doing what you're doing safely, and you're not putting your license or put patients, it's not even the license, you're not putting patients at risk for things that could have been avoided. You understand? So make sure that's not the situation. So yeah, so she is like, I don't know, but we need to figure out what we're doing with social media. I've seen a lot of persons who have millions of subscribers. I've seen them with thousands of subscribers, and they are at work, they're doing their thing, and they're doing it in a safe manner. They're doing it in a way where they still can have a job where they're being paid. They still can have their social media platform to provide awareness to other persons. You understand? And they still can generate, funds or anything, whatever their main goal is from the social media platform. It's still working for them. They're not putting out things that are going to implicate them or make them, a bad person when it comes on to getting a job. Because I'm telling you, if you don't realize nowadays, sometimes we are applying for some jobs and we really don't know why we don't get through with those jobs. Even when you feel as though you're very qualified, you find yourself not getting the job because of one or two reasons. You understand? Sometimes you're applying for a job and they only need to look at your name. You understand? Because a lot of us are searchable because we have social media platforms. You're on Instagram, TikTok, Twitter, LinkedIn, Facebook, YouTube, we're on all of those platforms. So I don't know how many times you've applied for a job and probably you don't get through with the job, or you're applying for a new role in your current position or your current job, and you realize they say, they find somebody else for the job, or they don't give you the job, and you're wondering why they didn't give you the job. And the person that they choose, probably you're feeling like, that person is not that qualified or has the same qualifications as myself. But sometimes you don't realize that, you see, a social media platform, that is what persons are looking on to give you a job, because it is easily accessible. If they're able to see who you are based on your social media platform, they can determine whether or not you're a candidate for, the company. They're going to determine whether or not you are suitable for the position that they have offering, whether or not you're going to be meeting the standard that they have at the facility. So you have to be careful with your content that you're posting, because it's not only for your viewers who are there and watching, because they have a real interest in your content. You have persons out there who have an interest in your content only because they want to kind of see the kind of person you are. You understand? They want to know whether or not you're a professional at all time. In my country, if you were seen at a bar, if you take a picture and you were seen at a bar with like a wine bottle, a beer bottle in your hand, or on any videos, then there are implications that can arise from that. You understand? Because nurses are supposed to be professionals who are out there making a change. There are certain criteria that nurses usually carry. You understand? And you're expected that even if you're out of uniform, you're supposed to be acting in the manner of a nurse. You're supposed to still be acting professionally in everything that you're doing. So it's not only about, getting in your white uniform or getting in your scrub and that's it. No, you're supposed to be a professional at all times, and that's just how I was trained. You have a lot of persons out there who are still being professionals and they're still doing their thing, but you have the 1 and 2 that is just making it so bad for the profession of nursing. And those are the ones that usually are going viral. Those are the ones that are getting, you know, the recognition that makes the profession just looks bad. And sad to say, yeah, I'm disappointed. I'm just disappointed with how she went ahead and did all of that, because it speaks poorly about your facility, speaks poorly about you as a nurse, the care that you're giving as a nurse. You know how expensive nursing school is. You know how expensive it is. And I'm sure you had plans. I'm sure you had plans to do, you know, more than what you were doing now. I'm sure you had plans to do more than what you were doing now. And this is what it is, you know, 1 year in nursing school. This is what you are, you know, you're at. 1 year in nursing, this is what you've become. It's just so sad. I'm so disappointed. I'm so sad for you, you know, because nursing is a very good profession. I'm so sorry you weren't able to come and give it to your best. You understand? I'm so sorry that's the situation for you. But to all the new nurses out there, be careful. The platform can be used in a positive way. It can be used in a positive way. You don't have to try to see if you can go viral by doing something, let's just say, quote unquote, stupid at work. You understand? You don't want to have a viral moment that ruin your life, your profession. You understand? Don't let it be a case like that. Go viral because of something positive and not something negative. When persons are out there giving you advice, go ahead and take the advice, listen. And even if probably you don't agree with the advice at the time, stop, pause, and ask yourself, why would that person be saying this? Because a lot of times persons will give advice and we feel as though the tone is off, so you don't take the advice. The color is wrong, so you don't take the advice. You are too junior, so you don't take the advice. You are too senior, so you don't take the advice. Sit down and listen. Think about, why is it that this person would be giving me this advice right now? Am I doing something wrong? Am I doing something good? Sit, ponder on it, and then make your decision. But don't let it be a case where, you know, a person's advice goes to waste, and then later on you're gonna be saying, if I had known. You don't want that. If I had known, because your life already done ruin. You already had made a decision, and now you are paying the price for the decision that you had made. So don't let it be a case like that. Please, may I beg you no, please. Don't let it be a case like that. Social media is good and social media is bad. And we all already know that. We know it. It's how you use the platform. How you use the platform is going to determine your place in life sometimes. You understand? So make sure you use it properly. And that's all I'm going to say on the matter, because I think I'm talking on this for a little bit too long. So anyways, enjoy the remainder of your morning, and I do hope you will have a wonderful day, whether or not you're watching this morning, noon, or night. All right.